Hi, this is Dr. Manuel Pardo. I'm an infectious disease specialist at Men's Health Foundation, and I'm here to update you on COVID-19. I want to tell you and give you an update of what's going on, not only here at the clinic and how we are actually going to assume the care of our patients in this emergency situation. First and foremost, please do not panic. Everybody has to keep calm, keep control of what the situation is going on. Things that you need to do: social distancing, and social distancing. You must do this at this point in your life. Please stay at home as much as possible. Try to avoid any crowded places. Go to the grocery stores only when they are expected to be not as crowded. Grab the essentials and go back home. Enjoy your time at home and relax. Avoid any contact with anybody. Do not let them be closer to you, no more than 2 to 6 feet from you, and just be there. This is very important because what does is actually it decreases the contagion rate of this infection. The coronavirus is spreading alarmingly in our community, and we have had cases here in LA that are exponentially going up. This is going to create a surge of patients in the hospitals, and we are not capacitated to get all of that surge of patients. So this is extremely important that you collaborate. It is a civic duty for all of us to please social distance for everyone. If you're having symptoms, please call our line. We are here only for urgent visits. The last place you want to go in this type of emergency is a healthcare facility, because we are dealing with sick patients. And even if we take the most strict measures, this virus is extremely contagious, so you must remain home at all times. Come only to the doctors for urgent visits, period. What happened with HIV positive patients? Those patients are actually, we need to test them as immunocompromised or assess them as immunocompromised. So yes, they're going to be an increased risk. Much more so those patients who are HIV positive with lower CD4 counts, and also if they are not taking adequately your HIV medications and your viral load is high, that puts on an extreme risk. Other immunocompromised states will be if you have diabetes, heart condition, and or any other, like if you're taking any medications that may decrease your immune system. You have to stay home and adhere very much so to all of what we have just said. We are working as a community, and currently we need to not think as a self person. We need to work for our community. We need to help all of us, and if we do not do a good job, people are going to die. So currently you have literally, you're saving lives just by adhering to this type of social distancing and these practices of good hand sanitizing. I also want to reassure you that pharmacy is going to continue to be open. We are going to be here in the clinic with limited staff. We're going to be able to see only urgent visits. Urgent visits are those patients who are symptomatic or require any acute care. There's going to be limited staff, so please be mindful. We know that it's going to be somewhat of a hassle to get through the call center, but please be patient. Remember, always rely on the patient portal to send the messages and communicate with your providers. We will be checking those in these hard times, and we will try to accommodate as much as possible all of your medical needs while this happens. And the last thing is the office visit is going to change. Please reschedule all of the non-urgent visits as of now until the end of March. And as you know, with this pandemic, things are going to be changing rapidly. So stay put on what other decisions we do. With this, I leave you and I wish you the best. Again, do not panic, stay home, and please follow the social distancing. That's the best that you can do to help us tackle this infection. We are all in this, and then we need just your support.